Hi, this is Dr. Mary Beth. Welcome to my massage and our 20,000 subscriber celebration. Figured we'd do a two-in-one since time is really short and I never get a chance to just talk to you guys directly since I'm usually watching me talk to other people and go through things. So it's really fun to get to. I'm going to go through some comments, I'm going to go through some questions, and if I think of something, I'll share. I think ever since I started the channel, I always wanted to present it as I'm a real person. And this isn't some show. It's not fake. It's not scripted. And, I'm a real person. And so I just am real thankful for you guys. This has been a fun journey and one I didn't know I'd be on, but here we are. So I hope this is enjoyable. We'll probably take about 30 minutes or however long it takes me to relax. But thanks again. Um, so one of the questions from the 20 questions for 20,000 was, why do you believe that chiropractic works? And what does it actually do? What changes in the body through the adjustment? And scientific studies for the chiropractic are few and far between, I think it says. But I think it says hypothetical, if the bones do not move from the adjustment, why do people feel so different after? I think that's a really good question. And so that's where I start. But one thing I wanted to share is about me, that I went to a chiropractor not because my neck hurt or my back hurt, but I was always sick as a kid and got a lot of sore throats. So I was always on the pink antibiotics in the fridge that tasted like bubblegum, penicillin. And they were going to take out my tonsils and my adenoids, and um, wasn't sure what else to do. So I remember getting shots in the butt, and it was terrible. So my dad's chiropractor, Dr. Heine, said, well, why don't you bring her to me? So my dad started bringing me and my three sisters to the chiropractor when we were young. I think I was probably third grade, second or third grade, and he started adjusting us, and I didn't get sick anymore. And I think that choice to try chiropractic instead of taking out tissue out of my body that's there for a very specific immune purpose, was the right choice, because I think we're all born with a certain potential, and our potential is unlimited when we're born. Each of us has a different potential, but potential nonetheless, and it is altered by interference and good or bad. So I think the less interference we have in our bodies really opens up the miracle of what our bodies can do. So that's why I have a personal interest in it, and why I know chiropractic goes beyond musculoskeletal, that what I actually affect is the nervous system. And it is, so when I'm making an adjustment to the spine, I'm affecting the electricity in the body that comes from the brain through the spinal cord and out through the spinal nerves that exit at every segment of the spine. They go to every part of you, your skin, your joints, your muscles, your heart, your lungs, your gut, your sinuses, your brain, and opens up the ability of the body to communicate with itself and with the environment. And therefore, the feedback then allows the body to heal and perform as we can, which is really, truly unlimited. I think the human body is amazing. I think it's just a miracle. So what changes in the body through the adjustment? The nervous system activation, the electricity in the body, the function of every cell changes, and that includes the immune system, that includes blood flow, that includes muscle activation, that includes every part. So if the bones don't move, right, so it's not like I'm moving bones inches. The actual changes may be minimal, if not just maybe measured in millimeters, but the difference, so it isn't like a huge, like bones aren't moving like inches. So I think that's really important to note. And it's more the activation to the nerve system than it is how far the bones have moved. That gives me also, the most common comment I get is about my activator. That's the red clicky thing that you see me put on people's butts, knees and heads and other parts. And my comment is usually that the activator affects the body the way my hands do, in that it activates a nervous system response. And so a lot of force is not required to get a nervous system response. Sometimes people do need more, and so it's just up to the practitioner to determine who needs what and when. And so it isn't that we're moving bones a tremendous amount, we're activating the nervous system. And so that is why people feel so different. They have blood flow, they have nerve flow. And although I know studies are very few and far between, I think there's a few reasons for that. One of the biggest reasons isn't there isn't a lot of money in it. Most studies are generated and set up to prove a point so that somebody makes money. That may be an unpopular opinion, but I really think that money drives studies. There isn't a lot of money in proving that chiropractic works, and perhaps that could cause people to lose money. So, touch my screen here. So that is why there aren't very many studies, and I think it's a difficult thing to measure. I always talk to my patients that chiropractic is an art and a science, so there's absolute science behind it, but it's an art because every human being has a unique physiology and makeup and setup and needs a unique approach. So that's hard to measure. And also pain and or response is hard to measure. So the difference I had as a child saying I didn't get sick anymore, it can we do a study and show that? I'm not sure, but that is my anecdotal clinical picture that I experienced as a little human person and that I see every single day. So that was my start for this very fun video. I'm going to take a deep breath. So when did I start to be a chiropractic? So I graduated from chiropractic school in 2001. I was supposed to graduate in 99, but I took a leave of absence so I could go train, qualify, train, and then compete in the 2000 Olympics. So I was most of the way through chiropractic school and I took a break. I'm still friends with a lot of my original classmates. It's quite an ordeal to get through. But I knew I wanted to be a chiropractor since I was young. Since chiropractic had a big influence on my own health at a young age, uh, I knew I wanted to be healthy, or I knew I knew I wanted to be a doctor, and I wanted to help people's health. So it was just a matter of my young human researching what the options were, what that would look like, and I am kind of a weird person. I knew what I wanted. That's what I wanted to do. And it was about the same time I also knew I wanted to be in the Olympics. So from the age of about 9, I made every choice in my life towards those two ends, to go to the Olympics and to be a doctor. Which leads me to the next question that I got the other day was, am I a real doctor? And I think that's an interesting question, and I get it a lot. And I understand people think of doctor as white coat, MD, drugs, surgery. And that is definitely, I think, our cultural definition of quote unquote doctor. However, I am a doctor of chiropractic, as are my colleagues. And we learn and study similar hours, similar depth as medical school. We get a lot more in nutrition. And then, of course, the adjusting principles. We do not get the pharmacology. So my scope of practice looks very different than an MD or a DO or a dentist or a veterinarian. But each are doctors and each are trained in their scope of practice. So my scope of practice does not include drugs or surgery, but that doesn't make me any less of a doctor. The way I practice is very intentional because I base it off of my life experience. I was an athlete and at a very high level, and I needed me. And I didn't get me. I went through some difficult times as an athlete. I was in a car accident and my left arm wouldn't work. So as I was swimming in the 2004 Olympics, I had to literally throw my left arm out of the water because my traps wouldn't fire. which then I was depressed about. That's a good reason to be depressed. So they decided I was depressed and put me on sleeping pills. Or sorry, antidepressants, and then I couldn't sleep because of those, so they put me on sleeping pills. So my second Olympic Games experience was very different than my first, but it no less shaped the kind of doctor that I am. And so it's very important to me to look at each person as a whole person. And no, so part of that story too is I retired from sports, and 2004 was a heartbreaking experience. It was difficult for me to talk about. But now I look back and I know how much I gained from the tough times. And so I'm retired, I'm off all medications, and I started to feel depressed again and sleepless again, and I didn't want to go down the same road. And a patient of mine told me she was getting nutrition help from a chiropractor, so I went to see him, and he addressed me, t told me I had adrenal fatigue, and the only change I made was that I started supporting my adrenal glands with specific nutrition. And again, it changed everything for me. So, like, another huge shift in how I look at people and how I help people. And I know that I could do the most amazing chiropractic adjustments and get people better, but if I don't adjust their nutrition, if I don't look at their mindset, if I don't look at their movement, if I don't look at how much sun they get, if I don't look at their feet, their hands, I'm not going to make as much change as if I looked at the whole person. So that forms how I practice. Um, so all very good questions, and it's fun to get to tell some of these stories. Again, I scripted none of this. So, um, am I ticklish? I was very ticklish as a kid. I think I was ticklish everywhere, belly, feet, but now I think mostly right around my collarbone. I think I could be ticklish there. Um, have I ever had a client that smelled awful? Breath, feet, pits, etc. And if so, how do you go about handling it? And that's from Night Shifting. I Yes, of course, humans are humans and humans stink. I think I always approach it with compassion and um, understanding, and we certainly do our best to make sure we clean and sanitize the rooms before and after every person, including the air, so that someone else can enjoy clean air. I don't usually say anything. I figure everybody's where they are, and they may know it, they may not, but I'm going to treat them like a human being and um, go from there. I think the hardest ones are actually it's cigarette smoke, because that does tend to hang on and linger on. They don't obviously smoke in here, but it comes in and kind of gets everywhere. And then cologne. Sometimes when men come in or ladies come in and wear perfume or cologne and I touch them, it becomes part of me for a day, and that's very hard to get rid of. So I have a no scent policy. Not everybody reads that, but again, I just do the best I can to move on, and if it was something that I really needed to address, I certainly would. Can I do some videos of animal chiropractic? Yes. In the beginning on my channel, early on, you can look back. I have a few of mine on there. Animals are hard because they move around and you have to just move with them and adjust them, and we may have to hold their head so I don't get bit. But and they don't crack. Animals, I know you've seen the videos where you hear loud cracks of dogs or horses, and I think that you can, certain joints, like the hocks of a horse. But the way I was taught by two amazing veterinarians that taught me animal chiropractic is most of the time we don't get a crack. We're not, and like with humans, I'm not forcing a crack. I'm affecting the nervous system. And so I see a change. I do pre and post checks to make sure I get a change. But sometimes I know that a lot of you watch for the cracks and the sounds. And so my partner and I are figuring out how to do more of those. So we really do want to, because that actually is one of my favorite parts of what I get to do, and the part I want to grow most in my practice. Where is my cameraman? He said he'll make a face reveal at 100K. So stick with me, keep sharing, keep watching, keep commenting, and you'll get to see him. Um, no ankle monitor. Nobody was committed a crime. That was the microphone. And the one video of the big bodybuilder guy, we, because I like, the reason I take shirts off and the reason I have the ladies wear like a tank top or closer fitting clothes is so that you can easily see what I'm working on and what's changed. And so on him, there was nothing else to hang the microphone on, so we put it on the hat. So he wasn't being super rude. He was doing what we asked him to do. And then let's see. Where else? Why did I pick Tampa? And then someone asked, are you single? I am no longer married. But before I was unmarried, we were transferred here to Tampa. So that's why. But I also have family that live here. My parents live about a mile away from me. My sister lives about a mile away from me. And another sister lives close as well. The third sister still lives in Colorado. Her daughter was the skier. And she's a mountain girl and is an amazing person. So she comes to visit Florida, but she likes the mountains. Can everyone benefit from a routine chiropractic checkup from Melissa Temple? Hi, Melissa. Even when they don't have any concerns? Absolutely. That goes along with my opening monologue about the amazing human body and what chiropractic can do. I do recommend people do get routine checkups, tune-ups, I call them, maintenance work. And I think it's sort of like if I'm working on the nervous system and the adjustments, allow the body to communicate with the environment and the environment with the body. That does affect function and performance, and it keeps small problems small. So I like that. And because if someone comes in with me and into me and can't walk, can't turn their head, that takes a long time. Or a disc is, affected. That takes a long time to come back from. A lot longer than if than if they came in for regular tuna. And so Roger Whiting, who always calls me Dr. Crawford, I can't tell you how much that makes me smile every time I see it, because she is gorgeous, and I think you flatter me, but I appreciate it. It's a very nice comment. No, and I think I'm like every human, that I see everything that needs work, everything that's aged, everything that's not as it quote unquote should be. But I'm learning to embrace me and all the things. Let's see if I can find another question. Dope ass videos from Bobby Eaglefeather. Thank you. Thank you, All Rise, for saying that our videos are amazing. And what is it? Josh Salmons, 1867. Will you ever make a Patreon page? I think that is similar to a membership page, and I see you are a member. Thank you for your membership. That is a link on, I think, all the videos, but if you go to the homepage, you can certainly become a member. I do special videos for our members that support the channel regularly. I appreciate that. It takes work to do all of these, and for me and my partner. So yeah, go there and check that out. And thank you for being a member. We are hoping to do more member-only videos, which include what our vision for that is, to go and explore some of these self-care options and give you the scoop on what's good, what works, what it looks like, what it feels like, so that you guys can get an idea of things you can do for yourself. Oh, I remember somebody asked me a question about like equipment. Like I can't remember what page it was, but like what would I um, recommend for people. Oh, suggestions from Garrett. Suggestions for the best products we can buy for ourselves for back pain, a foam roller, posture harness, etc. I think that's a really good question because there are so many products out there that you could buy, some for a lot of money, some for not very money. And so, yeah, I'm trying some of these products to see what I would actually recommend and could recommend to my subscribers on my channel, and so, ones that I would say don't bother. I tend to be a very low-tech person. I like supporting the body to work as it should. Um, can tools help? Yes. I think most of the time tools are used short term, and then um, people forget about them and don't use them. So I like using the body as the tool. But I have a squat ramp, obviously, that I use for my workouts and for testing people. I like pull-up bars for hanging, doing dead hangs to decompress the spine and to work and stretch the shoulders. I don't do a lot of foam rolling. If I do, I kind of lay on it on my spine and then feel where my body sits in space and work on relieving and opening up some of those tight spots. I don't use a posture harness. I think that finding where we need to be in space is a really important awareness. If you use something, I think it might help you short term, but then as long as you are practicing and being aware when you're not using the harness, there's no harm in trying any of these things. Oh, one thing I loved for plantar fasciitis was it's called a Strasbourg sock, and it's very simple, basic. Sleep in it. Your toes are kind of towards, tucked up, pulled up, so they don't point at night, which helps um, with that tissue, because plantar fasciitis is one of the toughest things I've ever had to work on myself. I went through a phase of that. Very silly story. When I first started as a chiropractor, I wore heels. I loved wearing high heels, but boy, that was a dummy youngster mistake. But I also was running a lot, and it hurt so bad I couldn't walk, but then I would force myself to run on it. So that was kind of the end of my running days. And I did everything to fix my plantar fasciitis. I changed shoes. I didn't run. I did chiropractic, massage, electric stim, blah, you name it, active release. The best thing was that sock. So I do have a few tools that I like, and we'll work on adding some more of those to the page so that I can help you guys with your search. Same thing for pillows and mattresses. There's so many and such a personal decision. So I trust me, I do all the research on me, and if I really like it, I'll share it with you. Something really exciting coming up is I have invested in Shockwave Therapy, soft wave, and it's going to be arriving soon. So as soon as we can, we'll get that up and running. And I've heard amazing things about that for people's healing shoulders, knees, plantar fasciitis, back, discs, you name it, musculoskeletal. It helps to speed healing, stimulates stem cell response, and I can even use it on animals. So I'm very excited for that. So keep watching for that. Let's see. What other questions? Oh, how shoes and socks affect us being barefoot. Oh, that's one of my favorite things, because if I had my choice, I'd be barefoot all the time. Our feet are so important, and having strong feet is critical for the longevity, long-term health, long-term movement. And there's lots of people that talk about it, but when we put on shoes that have motion control or that have major cushioning or major arch support, or manipulate the feet and put it into sort of a forced position, I think it's counterproductive. It can be counterproductive. So I think maybe that's where you start, but I think you're always trying to look to making your foot stronger, and move the way it should. I don't think the body is defective. So even if you have flat feet or you have high arches, or you have abnormal motion in the quote unquote abnormal motion in the foot, I think the answer is still finding what you can get stronger and what you can get to move better. And that could be, your feet is related to your pelvis, your hips, your knees, the whole spine, the nervous system. So important. And that's why I look at almost everybody's feet that comes in, whether they hurt or not. So I would encourage you to be barefoot at the beach, in the grass, wherever you can comfortably. Hard surfaces will be hard if you have weak feet. So get strong feet. Hope that answered the question. Sorry, my phone just gave me a time limit. Thank you, Trevor, for your comment. So let me go back. I'm going to look at a few videos and see if I can find any other questions. Let's see if anybody has any comments on my most recent short. Oh, there I am. Talking. How do I find my comments? Oh, right there. Way to go, babe. 25. I was first. Like and view and first to view the video. Thanks for being first. Kenneth Steelhammer asked, in what sport did I compete? I competed in modern pentathlon. It's a 5-sport event where I did shooting, fencing, swimming, running, and riding a horse that I did not know over a 15 obstacle stadium jumping course. And so the horses had to be qualified that they could do that physically, but some of the horses in the draw, because it was luck of the draw, were better than others. In 2000 in Sydney, the horse I rode, smooth operator, we knocked one rail, or did we knock two? I can't remember. Two. We knocked two. And the other girl was taken off in a stretcher. He was a difficult horse, but I luckily have been riding since I was young. I love horses. I love the way they smell. I even like picking up their manure. It's so weird, but it's so satisfying. Yeah, see, I'm a country girl. I like all that, but that was the sport I did. In 2000, I competed in Sydney, and I was 4th place. My teammate was silver, Emily Dariel, and it was one of my most favorite memories. And in 2004, I was, I think, 15th. It was a very difficult day, but I ran really fast and finished well. So I think it's a weird thing, but I remember what I was thinking while I was running, and it's kind of that moment. It hurts so much. Should you just give up? I'm not going to win. I'm not going to medal. I'm not even going to be close. Doesn't matter. And I decided it mattered, and so I left everything on the field. And so, even in the hard times, I think remembering that it's how you finish. So, Jared 9135 is I'm the internet's crush. Thank you. Yay, you're first. Okay, so let me go to another video. Also, I'm not very tech savvy, which is why I have amazing help. So I hope we get to 100K, because then he has to show himself. Where else did I see good comments? Oh, sometimes I get comments. Oh, let me see if I screenshotted some comments. So sometimes I get comments where people don't like me or don't like what I do. What is one of it? Oh, I get called a quack a lot. That's fine. I know I'm not. I also understand that everyone has their own experience, and maybe you had a bad experience, and maybe you went to somebody who hurt you or didn't do anything for you or wasn't honest. There's lots of things that humans can do that discredits other people and others in the profession. So I'm aware of that. And so I always understand that people may have had those experiences. This one is when I was adjusting the big guy, the bodybuilder guy. He is a bodybuilder. He's actually trying to go for his pro card. He's going to do his first show soon. And so we were talking about that in one of his follow-up visits. And a lot of people talked about him doing leg day. I like to think that his adjustments will help him do better on leg day. but his whole face changed. His eyes were less swollen. He could breathe better. Not perfectly still. There's still some probably underlying issues like a septum issue or ongoing environmental issues, whether the air quality at home and stuff like that. So, but somebody, Evie Mag, said, and I'm guessing they were saying that he was too big for me. The doctor necessarily has to be a man. I'm not against her. And they're not wrong, because sometimes I think it does help. It would help if I was taller or bigger with some people, um, but not necessarily. Some of my hardest people to adjust are little tiny women that are like Gumby, and you have to really get them locked out. It's difficult. Um, so it isn't always necessary that I should be bigger, but I do the best I can, to make the maximum use of every angle, every um, bit of strength that I have, and I am pretty strong, so I have that going for me. Oh, I love this question. This is the one I says. Let's see, it's Khan Kubrat Dulo said, "Don't get me wrong. Just what do you think? 500 years ago, man warriors didn't those kind of adjustment, and they still do what they do. Oh, they didn't get those kind of adjustments, and they still do what they do. They're stronger than ever, riding horses through mountain, etc. What do I think? I love that, and I think number one, I think that people that like I think in Egypt there was, hieroglyphics, and it could be just a made up story, but I'm maybe a little bit what do I say? Not gullible. I'm but of people getting chiropractic adjustments dating back to ancient history. So I have to believe that it's an ancient practice, not unlike acupuncture. Because I mean, people walk around and have no knowledge of chiropractic and crack their necks or their knuckles or what have you, not knowing, but know that they get at least a temporary relief from that, or they've built up such a habit that they need to do that. So I have to believe that that's been part of our existence. Um, but also, yeah, I think that people that move, that people that use their bodies, that people that work hard, that people test themselves and move, continue moving, do age better and probably need less intervention. So, and they ate differently. I think part of how we eat now really leads us to a place where our chemistry is not what it once was. So yeah, they needed less interventions. The body responds perfectly to the environment that it's given, which means that it's not making a mistake. Almost everything that it does is to protect you, and or it doesn't have what it needs in order to mount the defense it needs to. So it's in our our body is just protecting. And so if you have all the right input as possible, I think you need less. So you're absolutely right. And I like that. So I think my goal is to get people to come in and understand that and do everything they can to be better, stronger from their cells up, and they need me less. So do I need to turn on? No. Okay. Okay. Oh, I think I had one more question. Let me see if I can find it. Oh, this is about Lame Kendrick, Lamel Kendrick maybe, said he learned on a different channel that wrestlers were doing decompression on each other with a towel called a ring dinger. I've heard of that, and I still see that. I know chiropractors use towels and things to do a quick traction motion. I use a Y strap. I do not do that on everybody. I'm very selective on who I do that to. I might just do the traction, but without the pull. I think I'd be very cautious about that. Just I I don't think you should do unnecessary cracking, and I think you should use a professional. But I know a lot of people do that, so I can say that there probably something to it. Let's see. I think there's a huge YouTuber that does the ring dinger. Um, let's see. Okay, so those are the ones, and then I don't know. I think I covered a lot of what I wish if we were sitting down talking, what I would get to tell you. And I know you watch this for educational and entertainment purposes, and um, But it's really fun to get to not only help people one-on-one, but then broadcast this so that people can relax or laugh or enjoy or even think critically. And so I don't mind hard questions. I mean, if you're rude, we're going to just block you. But if you're open to, what another perspective, then hey, I'm here for it. So anyway, I think I'm going to go enjoy the rest of my massage. Thank you guys. We're excited. So much coming, and we'll see you soon.